It's a Thursday night and we are back to chat about your eye health with Dr. Dirk Booysen. This is The Social Impact on kwmedia.life and I'm Keenan Williams and I'm with you every weeknight at 9 p.m. South African Standard Time. Now, a couple of years ago, my wife and I were walking around at our local shopping center and we then decided to walk into the optometrist's store and have our eyes tested. Now, it was more a thing of buying time while we waited for our movie to start at the cinema, but before having our eyes tested, I was really adamant that my eyes were perfectly fine and argued that my wife was indeed the one with bad eyesight. Now, obviously, hoping that she didn't need glasses or else she would really see how distasteful I looked on that particular day. But after the eye test, we found that she didn't need the glasses, but I did. And that was a real bummer because I didn't even imagine myself for somebody who needed spectacles. So now, yeah, I'm wearing glasses, which helps me see the words on my screen more clearly, but one of the things which came up on our commute home that day was the fact that I'm getting older and my eyes were deteriorating, and it brought up a lot of discussion, and one I thought we could have tonight with optometrist Dr. Dirk Booysen. Now, Doc, thanks so much for joining me on The Social Impact again. Tell me, what are geriatric eyes?
Thank you for having me on the show again. Today we'll just talk a little bit about geriatric eyes, which is just the opposite of pediatric eyes. Pediatric meaning young, geriatric meaning old. So it's not quite clear when we should be talking about geriatric eyes, but as one gets older, your tissues, first of all, in the eye specifically, loses clarity, and they don't regenerate as well as a younger eye would generate. So once you get past the point of, say, 40 years of age, you start moving into that arena where your eyes start aging. One of the most notable things people notice is that they can't focus near anymore, and that's called presbyopia. So that's all part of this syndrome.
Doc, earlier I was talking about my eyes deteriorating, and what are some of the reasons that our eyes deteriorate faster than others? Because I need glasses, but my wife, who's the same age as me, does not need glasses. Does it have to do with our genetics, perhaps?
Yes, to a certain degree there is genetic components involved, but there are also other things. As you get older, you tend to get disease like hypertension, you get disease like diabetes, cholesterol problems. So there's a lot of disease that go with it, and most of these diseases have a component that affects the eye. For instance, hypertension will affect the eye. Diabetes is a very well-known cause of problems with eyes. So as one gets older, you tend to have age-related disease or disease that occur more frequently in older age, and these things will all affect the eye itself. There are genetic components, as I said, most notably among them things like glaucoma or age-related macular degeneration. Those things have all got genetic components, but they occur in the older eye.
Reminder that if you have just joined in on the conversation, we are currently chatting to optometrist Dr. Dirk Booysen. If you have any questions, you can send them through to our socials at KWM Socials or via WhatsApp, text or voice message. The number is +27 76 476 9277. This one comes in from Rene asking, what are some of the common age-related eye problems?
Well, the most common age-related eye problem that you experience is presbyopia, and that occurs just after 40. Obviously, the closer to the equator you live and the more ultraviolet exposure you have, it can occur earlier, so even from 35 years of age, where in Scandinavian countries, 50 seems to be the age that they start battling with their reading. Now, the age-related problem with presbyopia relates to your reading work. So once you start going past this age of 40, the focusing system in the eye, or the lens in the eye, hardens up, and it can't flex as well anymore, so your focus point moves away, and that feels like your arms are too short when you read. This is easily remedied by a pair of specs or contact lenses. No amount of exercise you do will have any effect on this. So they say to me, but yeah, my uncle is 90 years old, he never wore reading glasses, and if you go and look at his eye specifically, you'll probably find that one of his eyes is short-sighted, or he may be a little bit short-sighted, which means he can read, but his distance vision is not that great. So most people, as they get older, they do different tasks. Some of them get more near-focused, and they certainly wouldn't mine being a bit short-sighted. But most everybody, there's a linear relationship between age and focusing, which was published by a chap by the name of Donders many years ago. And if you look at the table, you can determine roughly by knowing the amount that the person can focus how old they are, and vice versa.
Doc, Megan sent through a message asking, how do I prevent myself from having dry eyes without using any products?
Simple answer to that would be have a healthy lifestyle and healthy diet. It's well known that omega-3 plays a big role in the secretion of some of the oil from the meibomian glands, which forms part of the tear layer. Don't smoke. If you have diabetes or any conditions like hypertension, you need to treat them effectively. Have a good eye health or eye hygiene regime where you clean your eyelids properly, because dry eye has also been linked to biofilms forming on the lids itself. So what we do often in practice is to prescribe something that you can actually clean the eyelids. Like if you go to a dentist, they take the plaque off your teeth, and that's the same sort of thing with your lids. We never really clean the eyelid margins, and these biofilms form there. And biofilms form a nice environment for bacteria and organisms to live and grow in. And all of these things would secrete toxins into the tear film, which irritates the eye and it aggravates dry eye. So there's been a lot of talk about, maybe cleaning the lid margins a little bit more effectively. Now that doesn't mean to take a scrubbing brush and scrub them. We use a product called hypochlorous acid, which is very safe, and there's obviously other commercially available cleaning products on the market like Naviblef or Blefamide and things like that you can use to clean the lids itself with. But the main thing is check your diet and make sure that you eat enough omega-3s, eat fish and fresh fruit and vegetables. It'll help a lot. And then an environment that you work in. If you smoke, stop smoking. If you do a lot of computer work, make sure that you follow the 20-20-20 rule we spoke about last time, and see that the environment that you work in has got a little bit of humidity. You don't want a very dry environment.
Doc, a few people have been asking the question around glaucoma. Talk to me about what it is and how it gets treated.
Well, glaucoma is a very complex condition. It's not an easily understood condition, and certainly there's been a lot of strides made in understanding glaucoma. In terms of treatment, it's fairly simple to treat it. So the mainstay of treatment at the moment is aimed at reducing the pressure in the eye. But saying that, glaucoma is not a pressure disease. So although people with glaucoma tend to have high pressures, you can also have glaucoma with a normal pressure in the eye. So glaucoma should rather be seen as a disease of the optic nerve, and that's where the damage takes place. So you lose your nerve tissue. And pressure is one of the risk factors. Other risk factors are race, more common in black people. If you're myopic or short-sighted, you can have it more. Genetics play a role, etc., etc. So one of the risk factors then would be pressure. So the only thing that we can really modify in the eye at the moment is the pressure. So if you treat glaucoma, you use a drop. The mainstay of treatment is medical, so you use drops. And the drops are all aimed at lowering the pressure in the eye and thereby preventing damage to the nerve of the back of the eye. If drops don't work, there's obviously surgical procedures that can be done to also drop the pressure. So what is glaucoma? It's not a pressure disease, it's a disease of the optic nerve, and which will lead to loss of your peripheral or outside vision, and eventually you lose all your vision. So it's a chronic disease. It cannot be cured. So once you're diagnosed with glaucoma, the aim of treatment is to keep you seeing until you die. So once you have it and you don't use your drops, you will lose your vision if you don't treat it aggressively.
Vic sends through this text saying, "Hi, Keenan and Dr. Booysen. I have always heard the phrase cataracts been thrown around. What are cataracts, and can they grow back if removed? Also, if they are removed, does it have a negative side effect on our eyes?"
That's an age-related change in the eye. There's also metabolic changes. So if you're diabetic, you can have cataracts earlier, and other things can also cause it. There's solar cataracts and things like people that do glass blowing and so on can also get cataracts. But mainly the ones that we see are age-related. And they tend to occur from about the age of 60. In some patients as young as 40, you might see cataracts. Now, what is a cataract? A cataract simply means that the lens inside your eye, your natural lens inside your eye, loses its clarity. So I always say to my patients, like taking a glass of water and putting a piece of newspaper on the other side of the water, you can read the newspaper through the water. But if you drop 1 or 2 drops of milk in that water, you will not be able to read the newspaper. So your lens becomes cloudy, and that affects your vision. It's a very slow process in most people, so it takes time to develop, and that's why it sort of sneaks up on you. The remedy is to actually remove the lens in the eye, and nowadays you replace it with a plastic lens, a fold-up plastic lens, and you can restore vision. One of the nice things about this op is if you, for instance, have a big prescription in your glasses, we can compensate for that prescription by implanting a lens inside the eye to accommodate that as well. So cataracts are pretty normal. The first thing that you notice, normally when I see my patients, I always ask them the following questions. How often do you clean your glasses? Because the first thing that they think is their glasses are dirty, and when they sit and rub and clean glasses the whole day, and they're a little bit older, they most likely have a cataract change. So it's very easily remedied these days. A small surgical procedure done under local anesthesia, and the results are amazing.
Lastly, Doc, can age-related eye problems be corrected at all?
Well, it depends on the problem and what the diagnosis is. Certainly, things like glaucoma can be treated, but you can't fix them so that they don't occur again. It's a chronic disease which is not curable. Age-related macular degeneration, depending on which type it is, can be treated but not cured. So you can find that you have dry age-related macular degeneration. Currently there's very little treatment for that. The wet type, where there are new blood vessels that form in the back of the eye, these days you can have an injection in the eye to stop the growth of those blood vessels. So those things can be treated but not cured. In terms of presbyopia, we haven't had any products or anything that came on the market that can stop the lens inside your eye hardening or changing. So it can be treated, but once again not cured. And it's treated by the use of glasses. Remember, as the eye grows older, the tissues in the eye itself don't regenerate that well. For instance, if you look at your cornea, or the part in front of your eye, you see through inside, it's got a little layer of cells called the endothelial cells. When you're born, you've got a certain amount, and as you grow older, they sort of tend to get less and less, and they don't regenerate. If those cells are lost, the eye goes completely opaque or white, because those cells' function is to keep the eye dehydrated or clear. So when you have problems like that, you can't fix them, but most of them we can treat. And technology is getting to the point where some of things like macular degeneration, we may have electronic devices that we can implant inside the eye which can restore vision. There's lots of hope for the future, but certainly some things are treatable but not curable.
That was optometrist Dr. Dirk Booysen chatting about geriatric eyes or age-related eye problems. Doc, thanks again for chatting with me on The Social Impact tonight. If you'd like to listen to more episodes of The Social Impact, you can visit our website, which is kwmedia.life. And reminder to follow us on all forms of social media at KWM Socials, and to subscribe to our channel as well, our podcasting channel, and to share the podcast with your friends and your family. Till tomorrow, when we're back with your African stories, from myself, Keenan Williams. Keep rocking, SA. Bye-bye.